the dentist's office? What did you just take?
That's a good question. At Dr. Murray, he had said to me, I looked at your x-rays and I didn't even need to look at your paperwork before I knew what was going on. Can you explain me a little bit about
Well,
that?
how I came to that conclusion?
Yeah.
Sure, just looking at your radiographs, I could tell based on where the decay was. We're talking lower mandibular posterior teeth. When you have decay on the lingual in particular, which is the tongue side of the tooth, the distal and the back side, just looking at where her areas of decay were, I figured immediately she's got to have something going on in terms of autoimmune, dry mouth, xerostomia, whatever you want to call it, as far as it's just not where you normally get decay. So then she filled me in on her medical history with a connective tissue disease. The J pouch would then has resulted in severe dehydration, which ultimately has led to the extreme dry mouth. The problem with that is when you have dry mouth, you're certainly at much greater risk for developing caries, dental caries, and sedated her before for a couple of root canals on the mandibular left side. This morning's the mandibular right, which is literally a mirror image of what we saw on the left side, which is decay on her back two molars. Again, I'm sure mainly due to xerostomia and autoimmune issues. It's my ultimate sort of generic take on that.
And have you seen with this that it's common with people that have autoimmune or chronic illness?
Especially when, again, the connective tissue disease issue. I see a lot of people with Ehlers-Danlos, kind of a similar thing. Some of them have dry mouth, and then ultimately they end up coming in, have a filling, and then they get recurrent decay, and then they end up having a crown, and then recurrent decay, a root canal, and a new crown. So it's kind of almost a never-ending cycle. The hard part is once you've had all the work done is maintaining what you've had done so you don't revert back to where you've been as far as whether it be prescription fluorides, artificial saliva. Those are things I'm not very well versed on. Generally it's the general dentist or the physician that hopefully helps manage some of those things.
Yeah, I was interested because you were the first person to ever tell me. I knew exactly what I was looking at.
You don't see cavities in those areas because generally, like your tongue naturally cleans the tongue side of the tooth just from movement, and that's where your biggest areas of decay were. And I'm like, it's just something's not right when you see it. That's what I knew. Something wasn't straightforward.
Yeah. Well, thank you.
Sure, no problem.
All right, and let's get some of these drugs in me so I can go to sleep.
Let's go ahead and start on Monday.
Yeah.
What did you just take?
That's a good question.
It's triazolam.
Oh, okay.
It's a little bit stronger than a Xanax. So,
Okay.
yeah. Did you get it?
Mm-hmm.
Okay.
Did you get all of it?
I think so. Oh. Well. Makes me look like a drug addict.
You're like, wait, give it to me.
A lot of people wake up cold.
So it's in her foot. How come?
Couldn't get a good one in her arms. You just want to hold really still there. So I'm gonna let go of it, so don't move.
Yep. This is Rachel. 2 hours post-surgery. She made it into the house. As far as the chair goes, laid down exactly in this position and has not moved since.